Good afternoon. Welcome to the daily briefing at the St. Clair County EMA office, where I'm joined by Chairman Mark Kern, and today the Director of the St. Clair County Health Department, Barb Hope. Barb, welcome.
Thank you. Good afternoon, everyone. It's a gorgeous, gorgeous day today. We have some updates for you folks. Today, we had 474 folks test positive for COVID, making that a total of 74,673 in St. Clair County since we started keeping track of these stats back in March. The 74,673 tested, 6,652 that are positive. Of those, we have only 20 new cases today, males and females under the age of 10 all the way up to the age of 70. With the 20 new cases out of 474 tests, that makes our daily positivity rate of 4.2%, and our 7-day rolling average of 7.4%. So we've been below 8% for 15 days here in St. Clair County. A total of 180 deaths. As Herb has said many times, one death is too many. We're fortunate that today we don't have any to add to that too long of a list. So completed folks that have completed the 10-day isolation period, that's 5,861 people in St. Clair County. Statewide, they had an increase of 1,462 positives for a total of 261,371. Makes that a total of 4,735,866 that have been tested. And unfortunately, statewide, we have an increase of 14 deaths. That makes it 8,309 deaths in Illinois due to COVID-related illness. Currently in St. Clair County, we have 49 COVID-related patients in the hospital. One patient is on the ventilator. And regionally, we have 95 COVID-related patients in the hospital and a total of 5 on ventilators. Again, that's regionally wise. For long-term care and congregate living facilities, we have 3 additional cases, 1 at Freeburg Terrace and 2 at Integrity Healthcare in Smithton. So those are the totals today. I know I'll be short because we got a lot of questions and answers to do today, sir. How are you?
I'm fine, Barb. How
Good.
are you?
Good.
Thanks for being here today
You betcha.
with us. So we'll move into the zip code report. At this time, these are the COVID positive diagnoses in each of these zip codes. Remember, these are cumulative numbers. They've been adding up since this thing began. So we'll go in and we're only going to read the zip codes that changed today. In 62201, we go up by 1 to 232. In 62208, we go up by 1 to 401. 62220 goes up by 4 to 525. 62221 also goes up by 4 to 626. 62226 goes up by 2 to 688. 62232 goes up by 1 to 185. 62243 goes up by 2 to 96. 62258 goes up by 1 to 177. 62260 goes up by 1 to 129. And 62269 goes up by 1 to 520. Our regional positivity today, that's how the state looks at the numbers. They merge or average or put the numbers in for the counties of Bond, Clinton, Madison, Monroe, Randolph, St. Clair, and Washington. They have the regional positivity today at 9.6%. I would note that Bond today is at 23.8%, Clinton's at 12.4%, Madison's at 7.3%, Monroe is at 12.3%, Randolph is at 5.7%, St. Clair 2.6%, according to the state numbers, and Washington County tops out at 60% today. So those are the other counties that are in our region and how they're reported by the state today. Herb?
Well, and the regional positivity as of September 10th is 9.6, down from yesterday. So those numbers are looking a lot better, and we appreciate everybody from Team St. Clair staying on target with us and watching those numbers and helping us get the word out there. Today is the question and answer day. We've got quite a few questions come in, and we got Brian Whitaker will read the questions off, and we'll try to answer them. And if we don't have the answers to them, we'll definitely get you one. And if you didn't hear your answer, ask us, because we had a lot come in, and we're trying to take them in order. Thank you. Brian?
Yeah, we'll start with health department questions here this afternoon. The first one that came in says, when you first started keeping track of positive numbers, the main cause was in nursing homes. Looking at the numbers now, it seems to be that it's in the general population. Am I correct in my thinking?
That is correct. At the very beginning, it appeared that the COVID-19 virus was mainly affecting those populations that already had some type of comorbidity, some other kind of illness. But as the virus spread, and as we learned more about it, because it's a new virus, we find it in our community. We find it, and that's the reason we do the testing, is to not only reduce our positivity rate, but also identify the folks that are sick in our community that may be asymptomatic and have no idea that they're spreading it, and pull them out of the general population to try to control that spread of disease. So that is correct, but it's spread everywhere. It has no age limit or place.
Okay. Now, the next one says, did the county health department say that it is safe to open schools? Because we've heard districts 201 and 118 are opening.
We've been in contact with school superintendents, the principals, the regional office of education since March, or even before that when COVID started, and giving the best guidance we have at the time according to CDC and IDPH and Illinois State Board of Education on guidelines for them to follow. Again, as we learn more about this virus, the schools have numerous plans, numerous types of plans of in-person, remote, hybrid plans, special needs populations issues of plans on, they know their school the best and how big their classrooms are, the needs of their children, and they have plans from A to Z to be able to deal with any of those. Again, it's up to each superintendent and their school board. They're the ones who open or close or say what level of education they would offer in person. We offer the guidance.
Okay. The next one says, why won't you post positive cases in schools like is done in nursing homes? I've heard of several school staff members who have already tested positive.
Again, it's up to the school policy as far as posting if they have their own personnel that are ill. Just because this person is ill and they're identified with the school may not be where they have contracted the illness. It could be from an outside event. It's not necessarily a school event. Again, that's part of our contact tracing methodology to find out where all have people been and who all have you been in contact with within the last 48 hours. So necessarily the source may not be the school itself.
Okay. The next person says, since schools are being allowed to open, will you spend days in classrooms making sure that social distancing is being practiced correctly?
Again, the health department ourselves will not be in there. We've again worked with the schools, the superintendents, the principals that have these extensive plans to help make sure they know their school the best and how big the schools are, how big the classrooms are, how many students are in each class, and ensuring that the teachers wear their masks, that the students wear their masks, that I've been through Belleville East and West and several schools of seeing what their plans are in place and the directions they have for the students to try to make sure to guide them, that they're not hanging around in the hallways and going one direction and trying to social distance as much as possible.
And Barb, isn't it through the local districts have to meet certain metrics that IDPH has put out and their guidance, or?
It's up to each school. Those are guidelines, what they can do. As far as schools, State Board of Education, and I'm sure Susan can talk more to this, is encouraging students to make sure, or encouraging schools to make sure that they're learning disability and learning students with different IEPs are addressed, because those are really, it's hard for them to try to learn. They can't learn from Chromebooks and remote education. You know, those are priority populations and students that they're encouraging them to have one-on-one in person.
Good. Thank you.
The next one says, if the virus is so bad, why isn't the county health department doing more to make sure restaurants and other food services are being monitored? I've called the health department and have been told they do not have the staff to follow up on complaints of places not following the guidelines.
And again, we do. And if you have an issue with a facility, and just please call us, and we will call them and let them know what the violations are, what they're mandated to do. If they continue to do that, we've been working with local law enforcement and municipalities. I know of several municipalities that have issued letters to folks that are in businesses that are in violation, be it a restaurant or be it an individual business. I know our sheriff's department is out and about ensuring businesses are in compliance with the current rules. They do that on a routine basis. I know we have several reports from this weekend where the sheriff's department and other law enforcement agencies from municipalities have been out and about helping us out. The health department's not the police. You know, our role is to give the public health and follow up with contact tracing. And again, this COVID virus it takes a community to do this. It really, everybody needs to participate. If you're sick or not, you may be spreading it in the community unbeknownst to you. So unless we all make sure we follow the rules and the 3 W's, as we've been preaching here for 180, 190 days, that's what it takes to get over this. And I think St. Clair County is starting to do a pretty good job. You can see our numbers, as we said earlier. They've been below 8% for the last 15 days. So keep it up, Team St. Clair, and continue to do it. We can't become complacent now either. But everybody's got to participate, because that's what it takes to get a handle on this.
And during a pandemic, you really have taken on almost a law enforcement type of duty here in the county, because the health department in many ways is tasked with sending those letters out and issuing the violation notices in conjunction with the sheriff's department, who's been going out and helping us, and finding out that there's some people that are just trying to figure out how to cheat the rules. And one specific incident in Allerton keeps on occurring, and eventually we're going to figure out how to we're going to get there, we're going to stop it. But the mayor has been in contact with us, and we're all trying to work together to try to stop the spread of COVID, and people that are cheating are making it even harder.
They are, and we can't work against each other. We got to work together to get through this. And you're right. I mean, we have contact tracers. We follow up on cases and contacts to cases, and we've had several positive cases of COVID that have been non-compliant, that we've also used law enforcement to help us track them down, help educate them, and make them realize how important it is for them to stay isolated and help control the spread of the disease in our community.
Okay. The next one says, is it true that private testing companies are not required to report negative results to the state of Illinois? And if that's the case, does it screw up our numbers?
In the state of Illinois, all labs are required to report positive cases of communicable disease to the local health department, the positive cases. The majority of the labs in Illinois report to what we call ELR, Electronic Lab Reporting System. The majority of them do, especially the larger ones that do the majority of the testing in Illinois. Our friends across the river and here at Memorial, BJC, is working on becoming part of that electronic lab reporting system. So when we do our daily stats for St. Clair County, we get a separate report from BJC that we report in our daily stats, along with the ones that we get through ELR from IDPH. But our daily reports are as accurate as they can be, because they're measured on the actual lab report, positive or negative, that we get into our health department. So those are the ones we are acting upon. But again, those positive ones are all reported. Are there negative ones that aren't? That is true, and we're trying to work on that to get everyone into the ELR system.
And Barb, you're not just sitting there, the health department's just not sitting there waiting for information to come in. You're, all of your people are out working hard, mining this information every day to put forth the most accurate number possible. So you're grabbing numbers from everywhere and putting them in a system to get this number that we talk about every day, which is, we proudly say is the most accurate number that you can get on St. Clair County's positivity rate.
Absolutely. Every single day, 7 days a week, we have staff that are working on, what's coming in as paper reports and faxed reports and what's coming in through the INED's computer system. And on a daily basis, we call long-term care facility to get their updates as well. And, we gather the most current information we can every single day. So those are the numbers we report to you.
Chairman Kern, we're going to move down to a couple that have come in for you. The first person writes, after 2 weeks at Tier 3, would we then move back to Phase 3?
So what the state has said is that they would reevaluate after 2 weeks of the new mitigations that they placed on us. The state never really went to full tier system. They kind of picked some mitigations that were in the next tier of mitigation and put them in our current current configuration. So the best thing that the most accurate thing I can say is that we believe it's Tuesday, the state will reevaluate our numbers. At the time the state added the mitigations, they said you need to be at 2 weeks of less than 6.5% in your region to be able to go back to where we were before with basically indoor dining and indoor bars. We haven't reached that level yet, although as we said today, we've been 15 days running average below 8. So our numbers are going very well. They could go better. We could be at 0, but since we've been doing this, we've seen our numbers in the 18% level, 16% level month to month, and now we are seeing numbers that are consistently below 8. We think we're doing well enough to perhaps warrant some of those mitigations being lifted, but we'll see what the state decides to do on Tuesday.
Well, I just as I'm sitting here watching some of these other messages come in, their county leaders and the municipal leaders are doing everything they can. For those of you who think that your community leaders and county leaders aren't, we're working day and night to try to keep these numbers and make sure they're balancing out and pleading our case. So please just remember that we're not just sitting here picking these numbers out of the sky. As Barb said, her staff is putting them together and we're digesting them day and night. So we are working around the clock to bring you the best that we can and plead your case for you.
And remember, we have been placed in Region 4. We are not St. Clair County, we are Region 4. And today, Bond County, which is part of that region, is 23.8%, Clinton's 12.4%, Madison 7.3%, Monroe is 12.3%, Randolph's helping us out with a 5.7%, but Washington County's at 60% today. So all of those counties' actions are inaction. That affects us greatly too.
Chairman, the next one that came in says positivity rate is not the best metric to be using. We've heard it time and time again. When will we begin looking at other statistics to make decisions on restrictions? The people are fed up.
So the state chooses to look at the positivity rate. I think most jurisdictions that I'm aware of do look at the positivity rate as the best indicator. If you think about it, positivity rate is a leading indicator. It tells you if you are headed into a problem situation. The problem situation, of course, since the very beginning, we've said, is a hospital that is so overwhelmed it can't take care of patients that have COVID. So what we have to be able to do is predict, hey, we got real issues coming down the line. It looks like, hospitals might become overwhelmed. That's when additional mitigations are put in to slow the spread down, to keep those beds open so that people have enough, the hospitals have enough capacity to be able to take care of patients, not only capacity, but also the ventilators, which, we're seeing now. They found other ways to treat COVID, and the ventilators aren't in as high a demand as they were, but that's always a concern because there is only a finite amount of medical equipment, medical personnel, and medical beds that are out there. So that's the reason for the using of the positivity rate as what the state is looking at.
The next one says, according to the IDPH mitigation plan, salons would be included in the next tier. What can we really expect if we move to the next tier? I know you kind of touched on that just a few minutes ago.
So there are a number of things that are in the next round of mitigations. I don't believe we're getting there. It seems to me that our numbers are heading down because people are doing what they're supposed to do, at least in St. Clair County. If St. Clair County's numbers weren't, as they are today, 2.6% according to the state, our regional numbers would be way high, and we might be expecting additional mitigations to come down the line this week. If we're down to 9.6%, I would say that it certainly, in my book, isn't warranted. Certainly in St. Clair, it's not warranted to be able to move into additional restrictions. But you are correct that hair salons are a possible mitigation factor. There are a number of events that they would roll back, including retail, those type of things that could be rolled back. We're not looking forward to that. We certainly don't want that. That's why we come here every day and ask you to wear your mask, wash your hands, and watch your social distance. If people did that, I heard on the radio today, and whether that's 100% best source in the world, but they said that if 80% of the people wore masks, that would be as good as doing a complete shutdown of everything. So wear your mask, it's important.
Okay. We'll go back to Barb for a few more questions about the health department, as they always have the long list of questions that come in related to this. The next one says, why would the county health department provide authorization for schools to restart when our positivity rate is still high? People are losing respect for the health department.
And again, as we've said several times, our St. Clair County positivity rate is going down because our community is doing the right thing. Unfortunately, we're lumped with the region. And the reason we're lumped with the region is because that's the hospitals serve a region. Not every county has a hospital, so that's where we're lumped with Monroe, Randolph, Bond, Clinton, Madison, St. Clair, and Washington County, because that's one of the metrics they use, as the chairman just talked about, is the hospitalization rates to make sure there are enough beds to take care of sick people. And the other piece of that, obviously, is the positivity rate, and the positivity rate gives that pulse of the community of where we stand. So again, St. Clair County, on its own, we have been improving, and we continue to improve. Again, it's up to each school superintendent, and each school board. They know their school the best. Size of their buildings, the number of students they have, the ability for them to make plans to be able to ensure they do the social distancing and wear masks and offer all those different guidelines as per State Board of Education and IDPH in their own buildings, in their own school districts.
Okay. The next one says, why doesn't the IDPH mandate hospitals have COVID units separate from other patients?
I don't know the specific guidelines for hospitals. We're not the regulatory authority for them. However, I do know that several hospitals and several long-term care facilities do separate their COVID patients from their non-COVID patients. They may have a special wing or a special portion of their hospital or their long-term facility specifically for COVID patients, as well as staff that are dedicated only to taking care of those patients in that wing.
Okay. The next one writes, now that Belleville schools are beginning to reopen, what are the specific metrics? For example, what would be the specific number of cases or the rate of positivity that would lead the health department or the Board of Education to recommend a return to remote learning?
And again, as we said, St. Clair County is doing a good job. We've been 15 days at or below 8% of positivity rate in St. Clair County. As I just said, schools know their own schools, and they have plans from A to Z to try to gear up or gear down on how to react to certain situations. We have a plan that has been put out by IDPH and CDC. It's called adaptive pause, meaning that, let's say, they may have an outbreak in a classroom, and it's just one classroom, so they would quarantine and isolate that classroom versus the need for having to close the whole school. Or if a school has too many employees, staff, workers that become ill, that need to be isolated or quarantined, and they don't have enough staff to operate, they may do an adaptive pause for 2 weeks to be able to handle the situation. Schools have done that already at the beginning of this school year. So there's several different gear up and gear down plans that the schools have depending on each specific situation at the time.
The next person wrote, have the new restrictions helped the numbers? Do the numbers support keeping restaurants and bars bars restricted, or do we need to try something different?
Again, as we said, we're doing much better in St. Clair County. But the thing to remember is because we're doing better, as I said earlier, let's not become complacent. It's community spread. Earlier, someone asked the question about, well, how come it was only in long-term care and now it's in 10 years old and less? The 29 years of age and younger is our highest incident of positive cases here in the last couple of weeks. So it's everywhere. That means it's community spread. People can be asymptomatic, they don't know they have it, and they can spread it. Again, that's the importance of making sure everyone just wear your mask, wash your hands, practice that social distancing, and we need to continue to do that. Team St. Clair, we've been doing a good job. Let's keep it up. But we all need to do it. And it's obvious it's community spread now.
And it's the ones that aren't doing it that are causing the rollbacks, that are causing the new mitigations. If everybody did what you're saying, we would be, we would all be doing much better. We wouldn't have to worry about new mitigations.
Absolutely.
The next person wrote, will there be a requirement for individual schools to report their positive cases? Do you see a requirement coming for that?
There is a requirement. Schools are required to report communicable diseases, not only COVID, but other communicable diseases in the schools that they're required to. They always have, and they continue to do so.
Now, that report, that's to the health department, but it's not necessarily a public report that they have. Are they required to report publicly they have this many cases of COVID in their school?
No, they're not. That's up to each school policy, but they are required to report communicable disease cases in their school to the local health department.
Okay. The next person wrote, I attend a small church and want to know what restrictions are placed on a person attending a Sunday morning worship.
Absolutely. There are guidelines that have been established. These are available on the IDPH website, the dph.illinois.gov, and you'll scroll down. There's all different kinds of guidelines, and there's guidelines for worship centers. So for churches, you're required to, it's preferred, guidelines are said to call in and make reservations for church, so there's not too many people, and everybody comes in and someone comes to church and they can't get a reservation or they can't get in because we're full. So they recommend reservations. Several churches have marked off benches and done the social distancing. They'll seat the church from the front to the back. A lot of people ask about singing or not. Obviously, you're required to wear your mask. If you have singing, their recommendations are at least 10 foot apart rather than just 6 within your church. And then again, proper sanitization when everyone leaves, and let's say there's a second service that day, to make sure that it's properly sanitized before the next group of people come in, again, to maintain that social distancing.
A lot of questions are duplicated here, so I'm trying to make sure we cover all the topics. One last one for the health department says, what would need to happen for us to change the metric from test positivity rate to something more like positive per total population?
Again, the positivity rate, as Chairman Kern explained earlier, that's the CDC and IDPH guidance used to measure the amount of illness within a population for a specific disease. Of course, we do maintain not only the positivity rates, but the hospitalizations, the number of hospital beds, to make sure that we have enough space in our hospitals to take care of the sick folks. And the really sick with the ICU beds. And again, that's why we're divided up into these regions, to make sure the hospitals are available to take care of the region.
Okay. Thank you very much.
You're welcome. If I may add
yeah,
one other
absolutely.
thing, I forgot to add all the test sites we have this week for the health department and throughout St. Clair County. So if I could add those real quick, on Tuesday, we will be at Smithton from 10 to 12 and 1 to 3 in their park, by the ballparks at the big pavilion just next near the water tower. Again, that's Tuesday from 10 to 12 and 1 to 3. Wednesday, we will be at McKendree University. This is open to the public as well as the students. We have a drive-up for the public, which you'll pull up in the Circle Drive in front of the Het Center. And then across in the quad, we have the walk-up for the students to be able, or anyone else that would like to. So that's Wednesday, September 16th at McKendree University. That one is from 8 to 4, both the drive-up and the walk-through. Then next Saturday and Sunday, we have Gateway Classic Cars in O'Fallon, the O'Fallon-Shiloh area. It's right next to Menards, and they have a great big parking lot. This is a drive-through only, and this will be from 8 to 4 at Gateway Classic Cars on Saturday from 8 to 4 and Sunday from 8 to 4. And of course, every day the Jackie Jorney Kersey Center is open from 8 to 4, so there's several testing sites available. And I apologize, I forgot to mention that earlier. I just wanted to make sure everybody knows that. And we'll, of course, have it posted on the Health Department and the EMO websites for you.
Thank you very much. Director Simmons, we had a few that came in on the EMA side. First one person writes, can we have a daily stat that shows the percent of currently sick amongst the county or city population? That way there's a constant of the population versus the amount that have been tested.
I really doubt that. I mean, we're graphed out, we're figured out. We put up everything now. We are the best we can, as accurate as we can, and I don't want to muddy the water anymore. So, I mean, we'll look at it, but right now, I think everything is where everybody needs to see it when we post it.
And on that zip code report we post every day, there's a link on there. And if you follow that link, it will actually tell you the total number of people tested in every zip code. So people can make a comparison on that reference. We give them every day as well. Next person writes, why is the Circle K gas station still allowing customers to come in with no mask? It says on their door that masks are to be worn, but I saw 10 people on Friday without them. No employee tells them to put them on.
And there's two ways to handle that. One, you can call that business and voice your concern. They should be adhering to the guidelines, but a call to the manager has been successful in a lot of those complaints that we receive here at the OC. And the other issue is if you've tried that and it hasn't worked, just find another place to shop. We don't want that to happen, but if businesses aren't going to follow the rules and you got enough concern about it, then either call and ask them to do it or find another place to shop at.
Or ask here and we can place that call.
We get calls here quite a few times a week, and we pass that on to the local authorities, or we make those calls ourselves to those businesses as a friendly reminder. Again, it's all about compliance.
Okay. And one more that came in that says, I reside in Madison County. Can someone show them how to set up a program such as this one? My family lives in St. Clair County and turned me onto this program. Thank you all for being true leaders.
Well, it would be helpful if all the other counties in the region was being as proactive as we are, and I'll pat us on the back a little bit because you can see from the stats today, if the other counties were being that proactive, then we wouldn't even be looking at any other mitigation. So thanks for the comment, but unfortunately we don't have any control over the other counties on what programs they have set up.
Chairman Kern, a couple more that came in. The next person wrote, people of the county want things to be open and be back to more normal. How is the leadership representing our county? Are you really being the voice of the people?
So, we are being the voice of the people, and when you're a voice, you have to have facts to back up that voice. And that's why sitting here and working. I know you guys were working till 10 o'clock on Friday night to try to put numbers together so that when we communicate to the state, we don't just say, hey, here's an issue we think we have. We say, here's an issue we know we have. How can you help us? What do we expect of the state with their mitigations and other things? We work with our state representatives, our state senators. They're all very in tune with the situation here in our county. And so I think as a voice, I don't think that there is a stronger voice out there that has spoken up for the county and continued to do so throughout this pandemic.
Well, I think Team St. Clair has proven that, leadership is one thing, but we need that voice behind us, and what Team St. Clair's been doing of spreading word is what's really getting us where we are.
Okay. And the next person wrote, Chairman Kern, the next mitigation review is this week. The numbers of the regional positivity rate is still above the required 6.5%. If more restrictions are placed on us, how do you expect county businesses to survive?
We will certainly be voicing the fact that we don't believe we need more mitigations, that our numbers in St. Clair County are headed in the right direction. Beyond that voice, we announced late last week or in the middle of last week that we're going to have another round of business interruption grants that we're going to be offering through the St. Clair County Intergovernmental Grants Department for businesses that are impacted. We hear you, and we're going to try to see if there can be county funding that can help with your situation. We all know that the business community has been heavily impacted in a devastating way by this virus. And I've got to say, I have to say that the governor does not want to shut down business. That's not his mission in life. But you've got, on one hand, you've got a COVID-19 virus that's out there, a pandemic, vulnerable people in this community. On the other hand, you had a vibrant business community, one that is less vibrant now because of the virus, but it will not recover and become completely as vibrant as it was until this virus is eradicated. And that's why there has to be some sort of a happy medium, or at least a medium point where government meets with business and the public is protected in the middle, but still allowed to go on in society and have lives that are as close to normal as they possibly can be. It's a difficult situation for everyone involved, but I can assure you that there is no one that doesn't want business to be as prosperous as possible. But on the other hand, everyone wants to make sure that we've got the death rate in St. Clair County is already too high with 180 deaths. We don't want to see that go up. The only way we can protect that number and keep that number where it is to make sure that COVID doesn't grow in our community.
Okay, thank you, Chairman. We're joined by Susan Sarfati, the Regional Superintendent of Schools, as we are on most Sundays, because as we do these question and answer sessions, a lot of questions come in that are school related. We've talked about quite a few of those already here today that you've heard, but a couple that came in specifically. What is being done in the schools to get the students back in in-person learning? Are they using things like plexiglass or alternative classrooms, or what are you seeing from a regional level?
The superintendents and I had a meeting this week via Zoom, and we've talked about phase-in plans and how to bring kids back into school safely, starting with those highest at-risk students, the special needs students, the students that are ESL, English as a second language student, and those that struggle, and then bringing back primary students. That's the plan that's been laid out by the State Board of Education. Schools are using every available means to make kids safe when they're in school, and the staff safe. There will still be remote learning options for parents that want to choose remote learning. So class sizes are automatically reduced by students that are staying home with remote learning. They're using things like the cafeterias when they're not eating and to make class sizes smaller. Some districts have developed a way that while the weather is nice, to take classes outside so that children can be outside, not just during recess, but also during instruction.
Very good. And one other question that came in said, why would the regional superintendent of schools support a return to in-person learning when the numbers are not much better than when the restrictions were put in place?
Well, as regional superintendent, I don't have the authority to say a school has to close or a school has to remain open. But we are working, the superintendents and teachers have worked very hard on developing phase-in plans. I think Barb mentioned earlier that they also have talked about different ways in which we may have to pull back if there's an outbreak within the school. My role is to give them the information, to tell them about IDPH guidelines, to share with them the guidelines from the State Board of Education, and to give them the information they need to make the decisions based on their school, the students they have, the size of their classrooms. That varies from school to school. So the number of students you can have back at one time varies. So they have to look at their particular situation, their buildings, their population. We have a building that has just kindergarten through second grade. They have different needs than other grade levels. High school looks very different than elementary school. So it's not a one-size-fits-all solution.
Okay. Well, thank you very much for joining us each week to answer some of those questions.
You're welcome.
And thank everybody who followed us today. It's a little long, had quite a few questions come in. There's a lot of them on there we couldn't get to on the live feed today, but we will look at them and try to get you the answers to them. We had a couple of pictures sent to us today from outside of our county, not St. Clair County, but of a bar crawl that was taking place. Hundreds of people on the parking lot, no mask, no social distancing, and those are the kind of things that will cause us problems. As you heard the chairman say, our numbers are going the way we want them to go now, but it's in situations like that in the region that will cause us that problem. So Team St. Clair couldn't be more proud of what you are all doing by spreading this and sharing the word. Continue to do that. We know there are still the naysayers out there. I don't care about them. If they want to join Team St. Clair and be part of the solution, welcome aboard, because we're not going to let our foot up off the gas until this virus is behind us and we can all get back to some sense of normal. We'll be back with Cindy and Daisy in just a little bit to translate this into our Spanish communities, and then we'll be back tomorrow with some more good numbers, hopefully. Good night.
Mask, gloves, soap, scrubs, TikTok, Grub, Hub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and lock
Buenas tardes. Hoy tuvimos a Barb Holt del Departamento de Salud que nos informó los nuevos casos del condado, que son 74,673 personas examinadas, 6,652 casos positivos con 20 nuevos casos, hombres y mujeres entre la edad de 10 a 70 años, 68,021 exámenes negativos, 180 muertes y 5,861 personas han completado la cuarentena de 10 días requeridas por el Departamento de Salud. Y los números estatales son 4,735,866 casos examinados, 261,371 personas de casos positivos con aumento de 1,462 nuevos casos de ayer, 8,309 muertes con 14 nuevas muertes de ayer. Y de estos casos positivos hay 49 personas hospitalizadas en el condado de St. Clair County y una persona en el ventilador. Y en la región 4 hay 95 personas hospitalizadas y 5 ventiladores. Y en las clínicas a plazo largo hubo cambios en Freeburg Terrace con un nuevo caso y Integrity Healthcare con 2 nuevos casos. Y Mark Hearn nos dio los códigos postales con cambios de casos positivos que son 62201, 232 casos con aumento de un caso de ayer, 62208, 401 caso con aumento de un caso de ayer, 62220, 525 casos con aumento de 4 casos, 62221, 626 casos con aumento de 4 casos de ayer, 62226, 688 casos con aumento de 2 casos de ayer, 62232, 185 casos con aumento de un caso, 62243, 96 casos con aumento de 2 casos, 62258, 177 casos con aumento de un caso de ayer, 62260, 129 casos con aumento de un caso de ayer, 62269, 520 casos con aumento de un caso de ayer. Y en la región 4 estamos a el 9.6%, y en los condados de Bond County estamos a 23.8%, Clinton County 12.4%, Madison County 7.3%, Monroe County 12.3%, Randolph County 5.7%, St. Clair County 2.6%, Washington County 60%. Y hoy tuvimos una sesión de preguntas que fueron hechas por la página de Facebook. La primera pregunta fue hecha a Barb Holt, fue si el Departamento de Salud estará revisando las escuelas que ya estén abiertas para ver si están siguiendo las reglas de distanciamiento social. Y la respuesta es que cada distrito será responsable para enforzar las reglas. Otra pregunta fue hecha si el Departamento de Salud castiga a los negocios o restaurantes que no sigan las reglas de distanciamiento social. Y la respuesta es que sí. El Departamento de Salud se encarga de las consecuencias igual que la policía local. Las preguntas hechas a Mark Hearn fueron que si el Estado reevaluará las nuevas restricciones puestas por el gobernador y si el 15 de septiembre sabremos más información sobre las restricciones y fases. Otra pregunta fue que si los salones de belleza serán afectados por las nuevas reglas si el gobernador decide implementar nuevas restricciones, y la respuesta es que no sabemos hasta el 15 de septiembre. Y la pregunta hecha a Herb Simmons fue si un negocio no sigue las reglas de usar el cubrebocas a la gente entrando, donde se puede reportar al negocio y pueden hablar al Departamento de Salud o su policía local. Y finalmente, Herb Simmons nos recomienda que sigamos usando el cubrebocas. Muchas gracias.